Good morning. It's the commencement of a new week, and welcome to the AM News here on the AM Show. My name is Pakwesi Shandov. To the very first story, Ghana Health Service says it has identified 40 additional persons in the Savannah region who may have come into contact with the MARBURG virus. The Health Service, about a week ago, received a report from the Pasteur Research Institute in Senegal confirming the first 2 cases of hemorrhagic fever. 11 of the 40 new contacts are said to be healthcare workers who are closely being monitored. As a news conference, Director General of the Ghana Health Service, Dr. Patrick Kuma-Abuati, said that the rapid response team has been constituted to support localized personnel in the Ashanti, Savannah and Western regions following this development.
99 were close family members or household or community contacts. And all contacts, as I said, has completed the 21-day as we speak. So if you see the map there, we have the solar tuna Kalba, which came into view because in the early phases, the first case was sent there and buried. And so during the burial and we had contacts there to look out for. We also have the Adansi North and to some extent Bekwai as the area of concern in Ashanti region. And then we have Western region, that's Pristia Huni Valley district, which is where the first case fell ill and came from. And so that's our main source of concern, that they may have been the source of the infection because the person was ill there before moving to Adansi, where within 3 days the system picked it up. Unfortunately, one close contact reported symptoms after the maximum incubation period. That was after the 21 days, reported some symptoms and died on the 21st of July 2022. This, I mean, for the sake of the family, these are very, very close relatives or members of the deceased, where under normal circumstances they are higher risk. But what is interesting here is that it came after the 21 days quarantine. So we've taken samples and following up with them. Currently 40, so because of that, the initial test had come up as positive for that close contact. And we have identified 40 additional contacts within the Savannah region where the incident occurred. 11 of them are health workers, and 11 out of the 40 are health workers, and the rest are other new members, including patients. Well, after the time, the patient had been discharged from quarantine, but we're still monitoring to see. Daily temperature in general health and well-being is being undertaken by health workers in the affected districts on daily basis. So we have instituted additional public health measures. These are, we have alerted all districts in the country to be on the lookout. And I must say that it's a very, very high sensitivity area. So we had a couple of cases that come close are tested, but so far we've had no positive outside these places. We've also the community engagement and risk communication, education on what to do, what not to do as part of the protection has also been done on, and then further investigation continue to go on to look at the main source of the condition. We've also constituted a rapid response team with the support from the regional and district response team to detail the investigations that are going on. We have looked at the clinical records. What we do is that we go to the facility in the area, look at anybody who has come there, because it could be missed, with symptoms that come close to that. And then we look at it. But so far, everything is fine. That's apart from the 2 cases, we have not had any one that comes close to that.